This is Tiffany Armstrong. I'm giving my informative speech on eating disorders. And Courtney is showing my audience. Madison, Eddie, and Courtney. Okay. Courtney's going to zoom in on the PowerPoint that I made for this presentation. What is an eating disorder? Is it not a show? Okay. Is that good? Mm-hmm. Okay. What is an eating disorder? Having an eating disorder is much more than being on a diet. An eating disorder is an illness that permeates all aspects of the individual's life. It's caused by a variety of emotional factors, influence, and profound effects on the people that are suffering from this illness and their loved ones. The disease can affect all races. It does not discriminate. Different types of eating disorder include compulsive eating, binge eating, anorexia nervosa, and bulimia nervosa. We're gonna Anorexia nervosa is the first eating disorder that I'm going to go over. This is an eating disorder where people starve themselves. Anorexia usually begins in young people around puberty. People with anorexia are very skinny but are convinced they are overweight. They use laxatives and excessive exercise. Anorexics have a fear of becoming fat. They develop deadly dieting habits and sometimes refuse to eat. Therefore, they are starving themselves. The disorder is thought to be most common among people of higher socioeconomic class, dancers, theater, and athletes. The next slide is symptoms of anorexia. 15% are below normal weight, as this picture kind of shows you with the comparison of the arms of somebody who is not anorexic to somebody who is. They have a loss of 3 consecutive menstrual periods. They don't want to eat in public. A lot of anxiety, weakness, brittle skin, shortness of breath, and they have an obsession of calorie intake. The next slide talks about anorexia and pregnancy. It's people with anorexia have trouble conceiving a baby. They have irregular menstrual cycles, and weak bones make it difficult. Not eating properly puts the baby in danger. Higher rates in miscarriages, and the babies are usually born very premature. The medical consequences of anorexia. Low body temperature, irregular heartbeat, shrunken bones, mineral loss, permanent failure of normal growth, use of laxative wears on the bowels, decreasing its function, and development of osteoporosis. The next slide is facts about anorexia. It can be a serious disease for older men. Anorexia can be overcome, which is one of the main points that people with the disease should focus on. With proper care, that is, you can overcome it. There's a lot of different treatment facilities, and sometimes you have to focus on the one that provides most for your needs. 1% of teen girls in the U.S. develop anorexia, and 10% of them die. A quote that I found was pretty relevant to anorexia. Some women and girls see themselves as fat when everyone else sees them as a gaunt ghost. Each year, thousands of people, most but not all of them, young women, deliberately starve themselves, sometimes to the point of death. Anorexia has recognizable signs, symptoms, and effects that can lead to a diagnosis of this dangerous illness. The next eating disorder is called bulimia nervosa. This is characterized by episodes of binge eating followed by inappropriate methods of weight control. They sometimes throw up, use laxatives, diuretics, and/or compulsive exercising. The cycle of overeating and purging becomes an obsession and is repeated often. Women with bulimia tend to be high achievers. People with bulimia consume quantities of food, sometimes up to 20,000 calories a day. This picture shows somebody who, with bulimia, might they see themselves, they're actually this thin, but when they look in the mirror, they see that bigger, overweight person staring back at them. Symptoms of bulimia include but aren't limited to eating uncontrollably, purging, strict dieting, fasting, vigorous exercise, abusing laxatives, heartburn, bloating, indigestion, constipation, dental problems, and bloodshot eyes, among many more. Risk factors of bulimia. There are certain professions where eating disorders are more prevalent. Thinness is usually emphasized in these professions. The professions include modeling, dancing, gymnastics, wrestling, and long-distance running. There are several problems from bulimia. They include erosions of the tooth, dental cavities, swelling and soreness in the salivary glands, stomach ulcers, ruptures of the stomach and esophagus, abnormal buildup of fluid in the intestines, bowel problems, electrolyte imbalance, dehydration, irregular heartbeat, heart attack, suicidal behavior, and decreased libido. Facts about bulimia. It affects 10% of college-age women in the United States. About 10% of individuals diagnosed with bulimia are men. 10% individuals suffering from bulimia will die from either starvation, cardiac arrest, other medical problems, complications, or suicide. Bulimia can be overcome. The last eating disorder I'm going to discuss is male anorexia. Anorexia is thought of as mainly a female disease, but this is a misconception. Men are less likely to seek help, though. Diagnosed an eating disorder in a man is more complicated. Men do starve themselves and exercise, however, they end up looking better and healthier and muscular. Despite the gender differences, anorexia and bulimia are characterized the same in both men and women. The symptoms of male anorexia are as follows. Noticeable weight loss, obsessive preoccupation with body, weight, and shape, abuse of bulk-up products, decreased sexual desire, depression, fatigue, vomiting, use of laxatives, use of diet pills, perfectionist behavior, isolation, and thinning hair. Things to look for if you think you know a male who is anorexia, or if they have a negative family pattern. Parents who stress fitness, media influence, traumatic events can trigger male anorexia, teasing by peers in adolescence, overweight in early childhood, confusion and anxiety about becoming a man, a job profession that demands fitness, and sports. The difference between anorexia and bulimia. The biggest difference between anorexia and bulimia is that people suffering from bulimia eat large amounts of food and then throw it up. This is called binge and purge. Anorexics do not eat large amounts of food and throw up, but bulimics do. And that is the end of this speech.